Thank you for joining. We will begin soon. Thank you for joining. Please enjoy the event.
Welcome, everyone. My name is Kings Floyd. I'm a research and policy associate here at the Century Foundation. For accessibility purposes, I am a white woman with a long brown ponytail, wearing glasses. Today, I'm in a white blazer and a blue and white scarf. We are so excited to welcome you all here today. TCF is a progressive, nonpartisan think tank that conducts research, develops solutions, and drives policy change to make people's lives better, with a focus on education, economics, disability justice, and healthcare. With that, I'm pleased to turn it over to my co-conspirator and moderator for today's panel, Veena.
Thanks so much, Kings. Welcome, everyone. Thank you for being here today. My name is Veena Smith Ramakrishnan. I use she, her pronouns, and I'm a fellow on the maternal and reproductive healthcare team here at the Century Foundation. For accessibility purposes, I'm wearing an olive green blouse, gold hoop earrings, and a gold nose ring. I have brown skin and curly black hair, and a virtual background with the Century Foundation's logo behind me. And with that, I will turn it back to Kings. Thank you.
We are incredibly excited to have you all here today. During today's event, we will discuss the intersection of disability justice and reproductive justice, now, which is a critical time more than ever to be having this conversation. Before we get started, a few housekeeping notes. Please note that this event is being recorded and live streamed. If you'd like to submit a question for our panelists, please do so using the chat feature. And now, we are honored to begin with remarks by Senator Tammy Duckworth. It is our pleasure to be in conversation today with Senator Tammy Duckworth, an Iraqi war veteran, Purple Heart recipient, and former Assistant Secretary to the U.S. Department of Veterans Affairs, who is among the first handful of Army women to fly combat missions during the Operation Iraqi Freedom. Senator Duckworth served in reserve forces for 23 years before retiring at the rank of Lieutenant Colonel in 2014. She was elected to the U.S. Senate in 2016 after representing Illinois' 8th Congressional District in the U.S. House of Representatives for 2 terms. Senator Duckworth, thank you so much for taking the time to be with us today in conversation and kick off this discussion we're having on the intersections of disability justice and reproductive justice on what would have been the 22nd anniversary of the landmark Roe versus Wade Supreme Court decision.
Well, thank you for having me on. It's a pleasure to see everybody here.
Wonderful. Senator Duckworth, among your numerous legislative successes in Congress, we would be remiss if we didn't also highlight the fact that you're the first senator to give birth while serving in office, and you've been a huge champion of so many family-friendly policies, including protecting access to the full spectrum of reproductive health care, including IVF and abortion care. So just to start off, we would first love to hear from you about why this intersection of disability justice and reproductive justice is personally important to you.
Thank you for that question, because it's my lived experience. And I think this speaks to the importance of having representation in the halls of power. I was in the House of Representatives for 4 years before I came to the Senate. And while I was a good, a progressive Democrat and I supported breastfeeding, it wasn't until I had my own child and was trying to breastfeed or pump breast milk as I was traveling that I realized how difficult that was. And so then I wrote and passed a legislation that requires all of those lactation stations in all the airports. So it's about representation. Until I, was a legislator dealing with giving birth and having a child, I didn't really get it until I lived it. And so this intersection is my life. And if I'm going through this, then lots of people are going through this around the country. And so this really is about the fact that we don't have enough people with disabilities and we don't have enough young moms in the halls of power who can speak to the challenges that we face every single day. And so, yes, these are family-friendly policies, and but this is really about the missing voices of millions of Americans who don't have full representation in, our own government.
I completely agree. Thank you, Senator. As you know, we are in a critical moment, politically speaking. TCF is a nonpartisan, nonprofit organization, but we are also an organization that champions racial, gender, economic, and disability equity and justice in our policy work. We understand there's a lot at stake for tens of millions of Americans in the next few years. What are you looking for in the 119th Congress that might find a path forward on reproductive justice, disability justice, or the intersection of both?
Well, President Trump during the campaign said that he was going to mandate coverage for reproductive health care, or IVF, for all Americans. He said that, so maybe he will. I've sent him a letter asking him to, now that he's president, to please make that mandate. He said he was, during the campaign trail, he said that he would require that there would be insurance coverage for IVF, which would be wonderful to have. Unfortunately, I do think that there are some challenges that we're going to have to face. So, for example, the president read from Project 2025 yesterday during his inauguration. And if you read Project 2025, it's got some pretty troubling things in it, to include setting time limits on Medicaid coverage and also arbitrary lifetime caps on benefits, which could put millions of Americans at risk of losing coverage. It looks to strip consumer protections from people who buy insurance on their own. Basically, that would allow plans to revert to discriminating against people with pre-existing conditions. Would allow insurance to set lifetime caps on coverage. It would charge people more you have disability, or deny them altogether based on their medical history, or exclude benefits for basic services such as mental health care or maternity care. All of these are really important issues for the folks on the disability community. On the other hand, I met with the nominee to be Secretary of Transportation, and he pledged to support the legislation that was passed that would make air travel more accessible. We've passed some landmark legislation that require airlines to pay when they break our assistive devices and to require them to provide assistive care support. And so hopefully that will continue, but it's really going to be a time where we have to be ever vigilant to what is happening so that we don't lose the benefits that we've gained, and that also we don't have things stripped away from us that we're already used to having, that we think maybe, we never dream that once again, we could be discriminated for having a pre-existing condition when you go to try to buy health insurance.
Thank you so much, Senator. And you just touched on a number of different policies that we at TCF are going to be closely tracking and keeping an eye on in these coming weeks, months, and years. We are just so grateful for your time and for you helping us kick off this conversation. And before we wrap and begin the panel discussion, our final question for you is, what can we as advocates in this space do to continue supporting the legislative efforts, many of which you're leading on the Hill, and partnering with offices like yours who are standing with us in the fight for reproductive freedoms for all Americans?
So two things. The first thing is the advocacy part, right? You and your members need to reach out to legislatures all across the country, both at the local level as well as at the federal level, to make sure that we have reproductive justice, that disability rights are upheld all across the country, to make sure that those who represent you in the halls of power understand these issues are important. So just your basic advocacy work is critically important now more than ever. The second thing is about the actual legislation itself. And this is where having the institutional knowledge, having the people with expertise to help us write the legislation, to help us craft the policy, is really important, all the way from state legislatures to the federal. When I go to write new legislation, like we did on airlines breaking assistive medical devices, we turn to organizations that in the disability community to help us write that legislation, because they have the institutional knowledge, so that my team, as great as they are, don't have to start from 0. They can start from 80 because you guys have that. And so leaning on you to provide that expertise is really, really important. And I think I'm going to add a third thing, which is absolutely be nonpartisan, absolutely be bipartisan, but getting more people to run for office and supporting folks and tell them, hey, you need to run for your local school board so you can talk about accommodations for students with special needs. Yeah, you need to go to your local library and be on the board of trustees to make sure that we have assistive devices. Yeah, volunteer at your work to be on a particular council or something. All of that matters, because it goes back to the first thing we talked about. Representation matters. And if you're not in the room, it's really easy to forget that you exist.
That's fantastic advice, I think, for everyone who's listening, including Kings and myself. And once again, thank you so much, Senator Duckworth, for your time today.
Thank you. Have a great day.
Wonderful. I am now so excited to introduce our phenomenal panelists today. We have with us Dr. Morenike Giwa-Onaiwu, who serves as founder and principal operator of Advocacy Without Borders, a research fellow at Drexel University, and a public appointee on the U.S. Federal Advisory Committee on Autism. We also have joining us today Robin Wilson-Beatty, who is a speaker, writer, and advocate for disability and sexuality. She is a member of the Association of American Sexual Educators, Counselors, and Therapists, and the Women of Color Sexual Health Network. Welcome, Morenike and Robin. We are so excited to have you both joining us today on what would have been the 52nd anniversary of the Roe versus Wade decision. As Kings mentioned earlier, we are currently in a political moment where so many of our rights have either already been revoked or are currently on the line, including access to essential healthcare like abortion and birth control. I would love to kick this conversation with you two off today, talking about bodily autonomy. Could you both share what bodily autonomy means to you as it pertains to this intersection between disability justice and reproductive justice in the work that you do, and also from a personal standpoint? Robin, why don't we go ahead and start with you first?
Hi, I am, first of all, I'm Robin. I'm a Black woman, a Gen X, where I'm wearing glasses, red lipstick, and a watercolor style multicolored dress. Um, what bodily autonomy means to me is that and then or the person is the authority and owner of my body, and that I have the right to decide what happens to it without coercion or violence or force. So this means that I get to decide whether or not I want to have sex and the kind of sexual contact that I want to have. I get the right to decide if I'm going to use contraception and what kind of contraception I'm going to use on my body. The right to choose and decide if I want to be pregnant and have a child, and or decide whether or not I want to give birth or not. Bodily autonomy means I get to decide when I need to see a doctor and get the choice to go see a doctor. It also means I need to be free from physical acts that I don't consent to. And bodily autonomy is a fundamental right. And with disability justice, as a Black disabled woman who is part of lots of different marginalized intersections, I feel like disability justice gives a framework that helps me, approach how systematic change in understanding how ableism, actually intersects with my other identity when I'm getting healthcare. And I have personally have experience with this as a disabled woman, but Black, who has experienced what it's like being disabled and pregnant. That was a whole different education in learning about bodily autonomy and learning about the right for me to be involved in my healthcare reproductive decisions. And for instance, when I got pregnant, because of my disability and all the things that were going on, I was strongly urged not to have that pregnancy. And part of that was based on the fact that, oh, well, you're disabled. But I also encountered some messaging around because of I was in the South, and the doctor that I had at the time was white and older, and he made it very clear, and he said in his remarks that when he saw me, that if I knew I was going to be disabled, why didn't I use birth control or something so that I couldn't have a kid? So these were things that was what impacted me in learning to speak up about bodily autonomy and what that means to me.
Thank you so much for sharing both your personal story and also just talking about intersectionality, which I think is so critical to this conversation. None of us hold single identities, and that really does impact the ways in which we access or are able to access healthcare and experience bodily autonomy. Marenike, I will go to you next.
Yes. Hello, everyone. I am Marenike Giwa Onaiwu. I am a dark-skinned, Black, non-binary woman with Black micro braids. Can't remember. I think this is called French Kiss lip gloss. with a blurred black background, wearing a black jacket and a black dress with a silver slinky in my hands, as well as black gloves. And I'm coming to you from the unceded Karankawa lands, AKA the Houston area. And I'm really glad that Robin laid such a great foundation for this question, because I agree with a lot of what she shared in terms of bodily autonomy. And so I'll just kind of supplement that with a few additional ideas or thoughts. And I want to give attribution to Sister Song, as well as the UN Population Fund, for helping to form some of these thoughts for me. And I'll kind of intermingle the work that I do and the personal aspect in my answer. And so the UNFPA, or the UN Population Fund, some years ago came out with the concept of my body is my own, and as Robin mentioned, being able to have the information, services, and the means to make decisions about your own life, free of violence or coercion, discrimination, et cetera. And so when I think about that, the element of like bodily autonomy, it being mine, it being for me, it's all of the elements that Robin shared, but it's also being able to, so not these things just existing in theory and in practice, but even in terms of how they are operationalized. So it means that true bodily autonomy is not being told by a provider, why didn't you use protection? Or experience that I've had when I, learned that a surprise pregnancy that I had some years ago was when I was in the process of miscarrying and being told, well, you're older now and you have disabilities, so it's probably for the best, by the OB that was treating me. And so when I think about how the term reproductive justice, when it was coined in 1994 by the Women of African Descent for Reproductive Justice Coalition that year, and it basically talked about the fact that needing to be able to have children or not have children, parent them, having our communities be safe and sustainable. So when you think about the disability justice principles, of recognizing wholeness, of cross movement and cross disability solidarity, of sustainability and interdependence, and all of these elements, and essentially Sister Song talks about the fact that reproductive justice simply takes human rights through the lens of the nuanced ways of oppression that impact those of self-determination and family creation with our bodies. And so ultimately, for me, the bodily autonomy is important because it needs to be more than a concept. It needs to be something that is tactile. You have to dwell in a society where such rights exist in the first place. The idea of bodily autonomy, where it can be, where it's something that's attainable. You need to be able to possess a sense of ownership and identity over your own body to begin with, so that you understand yourself and you are aware of yourself, and that you have not only the access but also accurate information to be able to consent and make those decisions about what you do and don't do with your own body. And so, particularly when there's such a history of disabled people having our rights taken away from us, whether it's, forced sterilization, whether it's guardianship practices that prevent us from having, healthy sexual lives, or lack of, of access to many things. It becomes really key that bodily autonomy is something that we not only know of, but actually can translate into action.
Marinike, that was just so artfully put. I really appreciate your commentary on how you're weaving these issues and ideas together. And that's part of the reason why I really wanted to start this conversation and have it be grounded in talking about bodily autonomy. I think that really is a through line that connects disability justice to reproductive justice and other issue areas as well. But as we're having this conversation, I think it's important for our audience to know where we're all coming to these issues from. My next question is for Robin, and it also kind of connects to bodily autonomy. Robin, you have an impressive background in disability and in sexual health education. And we know that comprehensive sex ed has been under attack in a number of states across the country. And the new administration has already outlined their desire to implement an abstinence-only curricula in Project 2025, which Senator Duckworth also touched on earlier. And so, Robin, could you talk a little bit about why comprehensive sex education is so critical for everyone, but also talking about why it's especially important for people with disabilities to access, some of the stigma behind why they often don't access, and your experience in your work there?
Well, okay, so let me start by talking about why comprehensive sex ed is crucial and important, and is something that should be taught in every school to every student. Because first off, comprehensive sex education that gives you the information, the tools that to empower a person, so you can make informed decisions about your sexuality, and it promotes healthy relationships, and helps prevent sexual exploitation, and ensure that a student has the knowledge to protect their physical and mental health like every person on this planet. So, but to address, but also comprehensive sex ed is important because it allows you to learn about and exercise autonomy over your bodies. When you are learning how your body works, when you are learning how, about consent, and learning about ways to how to exercise autonomy over your bodies. Without comprehensive sex education, you do have an increased risk of sexual abuse, because if you don't, not knowing what's going on, not knowing that you have this bodily autonomy, not knowing, the some of the consequences and things that can happen as a result of having sex like sexually transmitted infections or things like that, or also learning about your reproductive organs, and learning about pregnancy, and learning about where babies come from and how to make them, but it also gives you the tools of learning like self-determination and agency over your body. Comprehensive sex ed also with positive is also aligned with positive body image, and also it helps combat that stigma for disabled people, especially, that we can have sex, that we can be sexual, that we have the right to decide if we want to be sexual, and how we want to be sexual, and how we don't want to be sexual. And but also help combat and teach them that you also have a right to, if give and receive pleasure, if that is with consent, if that is what you want to do. But it's because disabled people face a lot of stigma in the first place when it comes to sexuality. There are many myths that exist in the communities and communities at large, be that medical, be it your personal community, whatever, about disabled people and their interest or ability or right to have sex. Comprehensive sex education lets you know that you do have rights, and you have the human right to know about your body and the ways that you want to use it. Does that make sense?
It does. Thank you so much, Robin. That's incredibly helpful foundation. And I know a lot of us, even working in the reproductive health space, sex education is something that doesn't often get talked about in general, let alone for ensuring that everyone is able to access comprehensive sex education. My next question is from Marenike. You've been engaged in a number of different impressive committees and agencies in and adjacent to the federal government over the years. And we work at the Century Foundation primarily on federal policy. So I'd love if you could talk about some of the ways in which disability advocacy and repro advocacy can intersect at the federal policy level. And then specifically, what are some pathways to success that you have found for truly intersectional reproductive health rights and justice work that's not only being inclusive of people with disabilities, which we often know is not the case in a lot of reproductive health spaces, but is also just intentional about centering and being solutions oriented around disabled people's lived experiences?
I love this question, and I'm going to try to give a truncated answer because I know we have some questions that have been submitted by attendees and other questions for Robin and I to answer. So I guess I'll start with the latter part of that question, and that is with regard to some pathways to success. And to me, the pathway to success is always going to be through the community, through meaningful engagement, leadership with the community, and not in a tokenistic sense, but in a way that truly centers and honors our expertise, what we bring to the table, pairing that lived expertise and learned expertise together. And so we're seeing more of this in research, but also in practice. And so, when I think about some of the elements of participatory work, a lot of whom we owe to the HIV activism community, a lot of the work that has been done in terms of partnering with, throughout all levels, from the local level to the network level and so forth. There are a number of practices or institutions that are putting this into practice. One is the National Research Center for Parents with Disabilities. They are doing amazing work now in their second iteration of really infusing the perspectives of disabled parents of all types of different disabilities, physical disabilities, sensory disabilities, psychiatric, multiple disabilities, and working together with researchers on a number of really important initiatives. Similarly, there's the National Center for Disability and Pregnancy Research, which is also doing really amazing work. There is the Research and Rehabilitation and Treatment Center through Ohio State University at Neislinger Center. They intentionally infuse lived disability experience into their work to the point where there is an actual leadership group called the DEEP, the Disability Expert, I've forgotten what the E stands for, program, but and who essentially are able to provide input on and make decisions on a lot of the elements of the work that's done there. There's the different autism centers of excellence, one of which is, at Drexel where I work. So there's programs that, and then there's the Policy and Advocacy Center. So there's programs that kind of take this idea, take it out of the ivory tower and translate it into practice. But I also think that people themselves can be their own pathway. When I mention it through the community, it doesn't have to be through necessarily an organized group. What was shared earlier about your school districts and so forth, these are places where your public councils and so forth, different meetings, whether they're municipal, state, or national. A lot of these places where you can present public comment. You can do as Senator Duckworth mentioned, and you can communicate with the staff of these elected officials, and make your perspectives heard. These are some very powerful things to do. And I think that also just kind of using holistic outreach, technology, social media, these are powerful places. But to go back to the first part of the question, and I'll try to wrap things up, discussing how disability advocacy and repro advocacy can intersect. And in doing so, I just kind of thought about some of the principles, the 10 principles of disability justice, and I won't mention them all, but I'll just kind of mention a few, and how they directly connect to a lot of the, reproductive justice advocacy work. And some of that is, for example, one of the key things that needs to happen, that happens with reproductive justice work is, like for us to examine and work to dismantle a lot of the power systems that we have, in reproductive politics, and that aligns well with collective liberation. There's also elements such as obviously looking at intersectionality. That's very key. Leadership of the most impacted, aligns with some of the reproductive justice principles of centering marginalized voices, and then just really joining together across issues. So when we think about a lot of the issues, so if we're looking at cross movement and cross disability solidarity and so forth, sustainability and wholeness, when we think about the issues that impact a lot of the disability community are things that are also relevant to reproductive justice as a whole. So whether it's comprehensive sex education that Robin describes so well, whether it's having alternative birth options and assisted reproductive technologies that are affordable and accessible, which ties to anti-capitalist politics, whether it's collective access to make sure everyone has legal rights and access to the things that they need, assistance to, for safety in terms of intimate partner violence, or adequate income to be able to stay in our homes, accessible homes, addressing some of the racial disparities in terms of maternal morbidity and mortality, even the access to the information being presented in a way that's clear and understandable for us, that's culturally affirming, that has that imagery of people with disability that's inclusive of us across our various different identities and our different families, and even the facilities themselves being accessible for us to be able to be there. So at the federal policy level, where we are determining funding, where we're determining doing quality assurance practices, and kind of assessing the importance of, this is where we need to speak about these concepts and how they need to be, how we need to ensure that they aren't just kind of gobbledygook, but they're actual things that, okay, this is, we need this policy, we need this type of comprehensive sex education. This is these are the curriculum that we're using. These are the disability experts that we've brought forth. This is the research that we're incorporating, and so forth, so that all of these various different pieces tie together.
Marenike, thank you. That is just a wealth of knowledge. If I were not moderating, I would want to be rapidly taking notes right now as you're speaking. You brought up so many fantastic points, and a lot of what you were talking about reminded me so much of Bell Hooks' feminist theory, From Origin to Center. I think that really encapsulates a lot of what you were talking about, and making sure that we're starting from the margins and moving inwards to make sure that everyone is not only has a seat at the table, but is actively engaged in the policy work. I also loved that you talked about lived versus learned expertise. I think that's a fantastic way to put it. My next question is going to go to both of you, if you both want to just give somewhat brief responses. I know these are loaded questions and there's so much to talk about, but I don't want to miss the fact that you're both parents, and this is an identity that you've both written and spoken about extensively in your work. And as I mentioned earlier, disabled folks are often left out of conversations about reproductive justice in general, but specifically about maternal health and parenting, especially in the policy advocacy space and in research and data collection. I think there's not enough information out there. Would you both mind speaking to your thoughts around specific challenges as well as opportunities that arise when we're advocating for equitable maternal health services for people with disabilities? And what does making parenting resources truly accessible look like to you? And we'll start with Marenike on this one and then go to Robin.
Sure. And because I'm really excited to hear what Robin has to share. So I'm just going to touch one part of the question, and that's about some of the ways that parenting resources could look truly accessible. And so a few of the ways, and some of this ties into my previous response, but First, it needs to be widely available to us, and it needs to be affordable, preferably free. If it needs to be covered by insurance. It doesn't need to be something that only if you have means or privilege that you can access, for parenting. It needs to be inclusive and multimodal. So it needs to be available online, but also printed, but also tactile. So if that means, um, little models with, where a person can understand what the labia is and the clitoris and this and that, so be it. You know what I mean? Things that we can manipulate. And then resources need to talk about things beyond just, the diagram of a body or making a baby or preventing an STI or what have you. It also needs to talk about pleasure, safety, some of the things that Robin talked about with relationships, consent. And not just heterosexual norms in terms of of what is needed, and not in a stigmatizing way, in terms of talking about different actions and bodies. And it needs to be community driven and multidisciplinary. So it needs to look like it needs to be decentralized. It needs to, and we some of these resources, we need funding to make these resources available in multiple different languages and at different levels of cognition as well.
I think you're on mute, Robin.
No, okay. You know that thing with the phone and like everybody keeps calling back and okay, yeah, that was what was going on. Okay. Well, one of the things that I was thinking about, first off, I guess because of how I think about like practicalities, whenever, when going to like maternal classes or parenting classes or things like that, there needs to be a way where we're talking about adaptive ways of child rearing. Like, okay, say you are say you're a chair user. How are you going to transport you and your child as you're getting around, showing different ways, like for baby wearing or adaptable strollers that you can use when you are a chair user or a walker user or things like that. Different adaptive ways for sleeping and feeding your children, adapted activities. One of those things that they talk about, okay, you need to teach your children how to be healthy, how to exercise, how to do these things, and showing you should go on, ride a bike or things like that. It's like, yeah, I am a parent with mobility disabilities, and yeah, bike riding is not something that we're gonna be doing together. But just things, just basic things like that, like how adaptive ways of like changing a diaper. When you might not have the limbs or the limb strength or things like that. There are so many different disabilities that need to have ways of being able to adapt how they're being a parent, but also when changing the language around, normalizing this. I would like to just see in when you are having parenting classes or whatever, where they mention and where they talk about disability when I am, in, the doctor's office, because generally, like if you are disabled and you are pregnant or whatever, you don't have like a special disability doctor or center to go to for parenting. You're in just where your community, where everybody, because you are part of the community. So, but in the literature, the teachings, they need to be inclusive of disability, and they aren't, like all the different various programs. And that also that goes for schools and things as well. I know that, part of being, a healthy parent is like also being involved in your children and being your children's academics or being part in their school community. And I've often had to approach at school and say, hey, I am a parent who wants to be involved. However, this is inaccessible. I can't get outside to go to the like carnival or whatever, because in order to get there, you have to go up steps and your elevator is broken, and I can't access that space. Or, okay, yes, oh, you can go on the field trip with us. Oh, yeah, but the bus that we're taking on the field trip, it's not accessible. So you're gonna have to bring your own vehicle if you want to go with your, be a chaperone for the field trip. These are all the, and you would think, but they all go together and they all tie together. And I think I even stood up in a PTA meeting, and I said, hey, because I talked about some of the things and the activities that were going on that were inaccessible for both disabled parents and students. And I said, I'm kind of blunt. And I was like, yeah, I said, disabled people have sex and we have kids. And so that's why they're in school. And therefore, we also want to be parents and take care of our children. So, we need to have ways to where people with disabilities are also able to participate and be a part of their child's experience in the school. That was just one way I was thinking about just practicalities.
I appreciate that so much. And I think this just really speaks also to why the reproductive justice framework, as you were mentioning earlier, Marinike, is such a good way for us to frame how all of these issues are so connected. It's not just about birth control or abortion or IVF or parenting. It is really a spectrum of rights and issues that impact so many different people across this country, varying abilities, disabilities, race, gender, and these are all things that we're going to have to be fighting for in the coming months. And that kind of leads directly into my final question for the both of you. The 119th Congress just began earlier this month, and just a few days ago now, the new presidential administration was sworn into office here in DC. As we're looking ahead at 2025, as we already discussed with Senator Duckworth, there are going to be a lot of threats and challenges that we're going to face in our shared goals of advancing disability justice and reproductive justice. And so I don't want to ignore the elephant in the room that is the state of politics at the moment. And so I'd love for each of you to share, if you can, some federal policy efforts or state level policy efforts that you're going to be closely keeping your eye on in the coming weeks and months that could directly impact disability justice and or reproductive justice. And we'll start with Robin this time.
Okay, I was like, can I go ahead and just, yeah, because I'm kind of excited, but not excited, but Medicaid. That is the cuts to Medicaid are what I am most looking at. Particularly, I'm looking at because Medicaid provides insurance, healthcare, of course, is crucial for everyone, but particularly for people with disabilities. A lot of disabled people in this country rely on Medicaid for healthcare for all sorts of intersectional reasons related to capitalism, money, access, all of those things. So Medicaid is crucial, and it is what keeps people alive. And also Medicaid, allows for vouchers, waivers that allows people to live interdependently in their communities, and have rights and decisions around, how and where they get to live. That being cut would be literally the death of some people. But particularly around reproductive health rights, I worry about, I'm watching very closely the languages around access to reproductive health services, things like contraception, not being covered, things like abortion, different. I worry about things on different state levels. It's not going that there different states are going to have different impacts, as we know. We don't all share the same culture around the United States around the legal rights to abortion, and or those kind of healthcare decisions, or and I live in California, but I am from the South. I am from states that have basically outlawed abortion, have abstinence only in the schools, um, and but also restricting and things around like contraception, and like what can be taught or what can be offered and who has access to those services. So I'm watching all of those. So yes, I am watching both federally Medicaid, but also how individually that's going to work, like how they're going to cut and what states are going to cut. And and also the schools with sex education. So those are the things that I'm looking at.
And in addition to what Robin shared, so some of my concerns are about some of the gender reclassifications and DEI ending federal support, and how that impacts the community, our communities, when we talk about disability justice and reproductive justice, and those most impacted. It's obviously, a number of us who are already experiencing a number of inequities. And so not being able to have the full spectrum of services that are necessary for harm reduction, for social supports, for testing, for prevention, for treatment, how that impacts racial and gender equity, that impacts a number of things, that's problematic in a number of ways for our communities. I'm also concerned about the impact of on how this could affect telehealth and how those services are accessible for some people. In terms of the economic piece, I know that there has been, I'm happy to see that there are people are making public comment about sub-minimum wage. We know that our community, disabled communities, tend to face persistent poverty, economic disparities a lot more than that of our non-disabled peers. So people making public comment about that, sharing, trying to find, more flexible ways to allow people, again, anti-capitalism, we are more than what we can contribute. Well, more, right. Additionally, the issues related to the schools, as Robin mentioned, not just with the comprehensive sexual education, but just in terms of like the states in general. We know a number of states are pre-K to prison pipelines. And so that's another element of reproductive justice, is safe and sustainable communities, the ability to grow up and be safe. And so when disabled youth are segregated, when we are more likely to be restrained, to not have an equitable education, then we aren't receiving the justice that we need.
Thank you both for detailing all of the number of threats that I think, I share a lot of your concerns. And I'm also grateful that earlier Senator Duckworth gave everyone such fantastic advice on how we can get engaged and involved in advocacy around all of these different issues that we care deeply about. We've received a number of pre-submitted questions from attendees that I'd love to, in the remaining 8 minutes, try to get through as many of them as we can for our audience members. I'll start with the first one, and either of you feel free to answer if you have a response to it. This person said, "I have been denied fertility treatments because of my disability. What can I do?"
A violation. The whether it's I'm so sorry, I'm not sure what's going on with my camera, but the American Society for Reproductive Medicine, I think the American College of acronym is, but essentially this is not something that they're permitted to do. Not be denied. It talk to an attorney.
Thanks, Veronica. Robin, I don't know if you had an answer to that either, or
No, I actually was I was just thinking because I have had friends personally have gone to a fertility specialist who told them, and who they both were little people, and the fertility, and they wanted to see a fertility specialist so that they could be able to avoid trying to have a child with a certain condition called double dominance that can happen genetically, um, where the child would not be compatible with life with that condition. And so they go to the doctor, the fertility specialist, and they're like, well, I don't think basically your disability of being, you being a little, I don't think that is supposed to happen anyway. So I'm not going to help you. So basically, like, well, you're disabled and your disability is not supposed to be here anyway. So it wouldn't be ethically right for me to help you. So that I'm trying to think legally what they ended up doing is just going to another fertility specialist. I know that's not an option for everyone. Not everyone has the ability to go basically fertility clinic searching for a fertility clinic that will assist them. But I mean, there's legally maybe you could sue for discrimination, but if you're wanting to actually go see someone, then the only thing I can recommend is trying to find another fertility specialist. And I don't know, I wish I had a better answer, but that's what I found, like, if that's what you're wanting to do in the now.
and Veronica, I don't know if your audio is working again, but you cut out a little bit at the end of your response. No worries. We'll go to the next question, and then if your audio is working afterwards, we'll come back to you. The next question that will probably also be the last question, because we're coming close to the end here, but I think it's a fantastic note to end on, is how can the research community support reproductive rights for people with disabilities? What evidence is needed by policymakers to protect these rights?
Okay, so I know that of course, here I am like offhand, but I know that there are a number of different organizations and groups who are, working on policies and research related to parenting and reproductive health care and things like that. Like, for instance, the Lurie Institute of Disability Policy at Brandeis University is one such center that is working towards all these kinds of research and policy related to and advocacy related to disability and disability and reproductive health and sexual health and parenting. So I feel like being able to connect as a researcher with, groups such as the Lurie Institute would be a great place to start, but also there's, if I had, I have ADHD, and I'm one of those people who I'm like, I want to answer this question. Like, I want to research and, come up with all the ideas myself. But, like, as far as what a good answer for this question would be. But the only thing I can think of is just to partner with other disability policy organizations that are, that do conduct research. There are, I hate that I'm drawing a blank right now. But anyway, Dr. Miranda Kay, are you back?
Miranda Kay was having some audio challenges at the moment. I'll see if she's able to come off mute now. But if not, that's okay. We understand technical difficulties sometimes happen. All right, it looks like her audio still isn't working, but we are nearly at time anyways. And so I wanted to make sure that I just took a moment to thank our audience, firstly, for coming and showing up today. I hope everyone learned something new. I know I actually took away a wealth of knowledge from our panelists and from Senator Duckworth. We also want to thank her office. I would like to thank Kings, my co-conspirator, as well as our wonderful panelists, Robin and Miranda Kay. Kings, is there anything else that you would like to close with?
I just want to echo my thanks to our fantastic panelists, as well as Senator Duckworth and our audience for staying engaged with us. We hope you will continue to be engaged with the Century Foundation, as well as the Disability Economic Justice team. And if you have any additional questions, feel free to reach out to us either in our YouTube channel or on our website, tcf.org.
Wonderful, thanks. And also thank you to our fantastic ASL and CART team for their support on today's webinar.
Yes.
We appreciate it, and we hope everyone has a fantastic rest of their day and of their week.